the single greatest antidepressant panacea, greatest mood altering thing in the world ever studied is gratitude. So at any given time when you're not feeling good, you need to learn how to switch to the gratitude channel inside your head. And that comes with practice. Right. So I would say to people, if you're watching something on television and it's really disturbing, or you're watching two people fight, argue, a married couple in front of their child, yelling at each other and swearing at each other or something, or maybe yelling at their child, what most people would go, well, I got to get away from that. I got to turn the TV off. But it's like, but that's not really what you should do, because then you're left lingering with that. What you need to do is change the channel to a happy channel, then turn it off.
So you're talking about the last image that you saw that stays kind of frozen in your mind.
Correct. But you can create any image you want inside your head. You can envision yourself responding differently in the future, even if you haven't done it yet in real world.
Yeah.
If you realize that your response pattern to a certain person or to a certain event, or to looking in the mirror, whatever it is not healthy, it's not producing feelings of contentment and satisfaction. That's the litmus test. Is your current internal dialogue producing feelings of contentment and satisfaction and happiness and joy and optimism, or are they producing something negative? If they're producing something negative, well, then change the channel.
So that's something that I think that pretty much everybody can relate to. We've all seen something really disturbing in a movie or on a TV show, and if you turn the TV off there and you go to bed, those images can haunt you as you try to go to sleep at night. And the best solution, my wife and I use it all the time, if we unexpectedly see something that, we didn't sign up for this type of thing, we'll put on our favorite comedian or something like that.
Exactly right. Yeah, of course. Yeah.
So what does that say for somebody who's a chronic pain sufferer, who's in that dark place all the time? What does that say for instance, what type of music they should be listening to, what type of books they should be reading, and the messages communicated in those books, what kind of TV shows and movies they should be tuning into? Because if I'm understanding this correctly, what I'm saying is, if you're very serious about getting out of chronic pain, you should not be listening to depressive or angry music ever. You should not be watching those types of things on TV or influencing your mind in that direction ever.
There's a great paper by Conversano and Giuseppe. I always remember that name because it's Italian, 2021. And they literally talk about exactly what you and I are discussing right now, which is that the science behind the idea of attitude and disposition and internal dialogue, and how it just absolutely has a profound impact on your physical and emotional well-being. Like, it's not maybe. This is like, listen, people, this is what I tell everybody. You are talking to yourself all the time anyway. Constantly. That's what brain cells do. They create thoughts, right? The cortical, so like your heart cells spontaneously contract, literally, right? Your lungs will automatically breathe it's part of your brain that does it, but you get it. But your brain, you are thinking all the time. So the question is, are you thinking in ways that produce a better life or a worse life? That's the question. Don't argue about reality. Like the pessimist says, no, you got to be realistic. It's terrible. And the optimist says, you got to be realistic. It's awesome. And they're talking about the same thing. So I never argue reality with people. You get to decide. So the question is, why would you choose thought patterns that aren't producing the best life, the best possible life for you?
If you enjoyed that short clip, click the link in the upper right-hand corner of your screen to see the full unedited interview with Dr. James Chestnut. Thank you for watching, and I'll see you next time.